All right, I'd like to begin right now. It's 6:42. We've got a lot to get to this evening. I am Monica May. I'll be your moderator for this evening's conversation. It's diabetes and it's linked to other chronic conditions. It's being offered through the Center for Change. This is our second year of presenting these webinars to you all. And thanks to the pandemic, Miss Pandemic, this is the way that we have been getting our learning operatives out there, and it's really been working. So we thank you, the community, for helping us do that. Tonight, we have two esteemed panelists with us. Dr. Parikh, Dr. Amai Parikh is a board certified internist, nephrologist. He also works in critical care as a neurointensivist at Advent Health. Prior to graduating from Tufts University School of Medicine, Dr. Parikh obtained both his bachelor's and master's in biomedical engineering. For the last 7 years at Advent Health, he's been the medical director of the neurologic and neurosurgical ICU. He now serves as the system director of neurocritical care, and he is also the consulting medical director for Our Legacy, which is Central Florida's organ procurement organization, and he'll go into that a little bit further in just a moment. Joining Dr. Parikh this evening is Kia Blair. She is the donor program specialist for Our Legacy here in Central Florida. Again, it's an organ procurement organization. Now, Kia is an experienced journalist and can be seen on a number of television shows. However, in her current role with the organization, she serves as intermediary between the organization, the corporate and hospital departments to bring about the most effective and best practices for organ and tissue donation. And we wanted to have her on because that's not something we as Black and Brown populations really talk about, nor do we participate in. She also oversees PR, public relations, and community involvement, as well as clinical education. In her job, she also meets with the corporate administrators to present information in an effort to improve hospital performance. All of her expertise has led to building and maintaining strong key relationships, which actually have led to a 75% increase in activity. So, ladies and gentlemen, we welcome Dr. Amai Parikh and Ms. Kia Blair this evening. So, Dr. Parikh will take it.
Yes. Well, Miss May, thank you for having us and for the introduction as well. I'm really excited to be here and be talking about something that I think is really important, and that is diabetes. Diabetes, actually, the term is a really old one. It comes from the Greeks. And what they noticed is that there were folks that were urinating a lot. And when they added the term diabetes mellitus, which is specifically what we're talking about today, they noticed after tasting it, and I know that sounds a little gross around dinner time, they noticed that it was sweet. And so then they gave it the term diabetes mellitus. And so that's how we have the disease that we are talking about today. And so what I wanted to do was to give all of you guys an overview as to what diabetes is, how we break it down into the different types of diabetes, because I know everybody talks about different types that are out there. We'll talk about the risk factors to getting diabetes, and then most importantly, talk about all the different things that it can affect in the body, all the different systems, that sort of thing. Because if we start to understand all the different things that it can affect in the body, then we are better able to recognize when we have it and when it needs to be taken care of as early as possible. So that's the goal for today. Ms. May, how does that sound? Does that sound like something that we can tackle?
I know we can tackle with you and Kia on board, so let's get started.
Okay, so the first thing is that I wanted to let all of you guys know about the different types of diabetes. And what you have on the screen here are 4 different types that are listed. There's type 1, type 2, gestational, and pre-diabetes. So just to make it simple in our minds, because I know some of these are big words, the type 1, which is usually what we see in kids, is when the body doesn't make enough insulin. Insulin is what the body needs to process sugar. Whenever we eat food, the food gets broken down into sugar, and we have cells in our bodies that need to take in that sugar. And in order to do that, it needs insulin. If the body doesn't make enough insulin, and that insulin comes from an organ that's called the pancreas, well, if it doesn't have enough insulin, then all this extra sugar is floating around. And when it starts to float around, then that's when it starts to cause damage. So that is what is type 1 diabetes. Lots of sugar floating around, but the main reason that it's floating around is because there's not enough insulin to process that sugar. And usually we start to see this in kids. Type 2, which is the most common, especially in adults, comes about because when the insulin is floating around, and here the pancreas is working well, but the cells, they're so used to so much sugar being around that they don't respond, or they don't interact with the insulin like they should. And the body keeps saying, well, I'm making all this insulin. Why are you not responding? So instead, then the body makes more insulin, and the cells don't respond to it. And so there's lots of sugar floating around, and it takes more and more insulin to try to get the cells in the body to take up that glucose. So here, the problem is that our cells, all those little cells that we have in our body, they don't respond to the insulin. And as a result, there's lots of sugar floating around. So there are two different types of diabetes here. These are the two main types. One is not enough insulin floating around, type 1. And type 2, the insulin is there, but the cells are not responding to it. And that's a huge problem. There's so many different reasons why the cells don't respond to it. And we'll talk about some of that today. There's two other types of diabetes that are listed here. One is called gestational diabetes, and that comes about when you are pregnant. Now, I won't ever get pregnant, but there's a large number of people that are in this audience that will. And when you do, some folks are at a higher risk of getting diabetes. And that's something that an obstetrician will take care of during pregnancy. And sometimes some people need insulin during pregnancy just to take care of the high sugars that are there. The fourth type that's listed on here is prediabetes. And what this means is that you are at risk for developing diabetes. Some folks have noticed that you are on the road to getting full-blown diabetes, and we have now given this a name, prediabetes. And the reason that we give it this name is that we want to start attacking it now, right? You want to take it on now before it gets worse. And so that's why we have this term prediabetes. So if someone is saying that you have prediabetes, then that's a warning call. That's saying, hey, this is something that you need to pay attention to now before it gets worse. And there are things that you can do to make sure that it does not get worse. So these are the different types of diabetes that are out there. Ms. May, what do you think? Questions about this or?
No, I think we can go through some of the risk factors now, like age, race, family history, et cetera.
Yes, these are also listed on the screen. And usually the older that we are, the body starts getting used to the insulin that we have. And so as a result, people can start to develop type 2 diabetes. Remember, this is the one where there's lots of insulin floating around, but our cells are not responding to it. There are certain races and ethnicities, for whatever reason, and we're not exactly sure why, but tend to get diabetes more than other races. And I think we'll talk a little bit about this later. Some of this is genetic. This is something that we can't change, right? That this comes from our parents in our genes. And as a result, we are more prone to getting diabetes. That over some time, our cells are just programmed, just like a computer, to not respond to insulin as time goes on. And this is something that we can't change. However, the things that we can change are number 4 and number 5. So number 4 is our BMI. What BMI is this is a calculation of a relationship between your height and your weight. Now, the higher the BMI is, that means that your weight is out of proportion to your height. So the higher that it is, the more likely that you will get type 2 diabetes. There's a lot more insulin floating around. in folks that have a high BMI, there's a lot more sugar that's there as well. And so the goal is to bring down that BMI. And people have found that if that BMI can come down, then they can reduce the risk of diabetes, and in some cases, even get rid of it completely. Now, this BMI depends on the level of activity. That's number 5 here. What this means is that if we do exercise, if we stay active, if we get that heart rate up, especially at least 3 times a week, that we can bring down our BMI, we can get rid of the extra fat that's in our body, and as a result, get our cells used to that insulin that's floating around. And so that if it can start to respond to that insulin, then it will process that sugar and actually get rid of it and bring down our sugar levels. So these are our risk factors. If you notice, numbers 1, 2, and 3 are things that we can't change. These are things we're all going to age no matter what, right? And nobody is immune to that. Our race and ethnicity, we can't change. This is something that we are born with. And our family history, this is what we are blessed with, how we were made from our parents, and we can't change that. But what we can change is our BMI, and we can change our level of activity. And specifically, what's also related is what we eat as well.
So it hits home, Dr. Parikh, it really hits home. We're taking a look now at some numbers here. You'll see 12.5% adult population in Florida has been diagnosed with diabetes. Look to the right of the screen and look at the population in the United States. And these are 2019 factors, 11.3%. So we're above the nation's norm. Adult population in Florida that's pre-diabetic. And I always say, if a doctor tells you you're pre-diabetic, if he tells it to you more than once, you're diabetic. You just need to really be realistic about that. But 35.7% of our adult population in Florida is pre-diabetic, with 546,000 in Florida, okay, that has diabetes and doesn't even know it. We'll tell you a couple of stories of some people that happened to and what extremes it went to. It hits even closer to home. When you look at the screen now, we're looking still from 2019, and these numbers are national numbers as well, non-Hispanic, Hispanic versus orange and Florida. If you'll look, non-Hispanic or Black, 7.4%, but look right next to it, the Hispanic number is 12.1. In the state of Florida, if you jump over, it's 10.6%. So that's pretty high, but even higher in Osceola County, if you look at that number for the Hispanic population, 18.3% versus in the state, 10.6%. So what's going on there in Osceola County? And then the disparities continue. Seminole County, 4.7, and then state of Florida, 10.6%. So, we're looking at these numbers and we're looking at them and we have to see them clearly for what they are. We've got some work to do, but that's why we're here tonight. Let's take a moment to see if you have any questions. You can put them in the chat. That would help us a lot. And as we go throughout the evening, make sure, just pop that question in the chat and we will make sure to get to it. Let's see if you have any questions about the slides that we shared with you. And if not, Dr. Parikh, let's continue.
Sure. So, I had mentioned that diabetes can affect a number of different organs. One of the most important ones is the heart. And the reason that it does this, and let me back up here just for a second to say that diabetes can affect organs or blood vessels that are small and blood vessels that are big. Now, I'm going to keep coming back to this point, and the heart is an example that has blood vessels that are sort of on the bigger side. And so this is where diabetes can affect big blood vessels. So we're going to talk about the heart. And what can happen with the heart is that diabetes can increase your risk of having a heart attack. So diabetes is that common factor that links to everything in the body. So as a result, if you have diabetes, and even if you don't, we are recommending that everybody get their own blood pressure machine. This is something that, you can get at Walmart, at CVS, um, Sam's Club, Costco, wherever, and that you check this on a regular basis. And the reason is that when you go to the doctor's office, or even if you go to one of these pharmacies and they have one of those machines there, you're only checking your blood pressure at one point in time. And what we would like to see is what your blood pressure is doing over different time periods. Sometimes when you go to the doctor's office, your blood pressure is high because doctors are scary. The other times too is that if you're going to a store and you're checking your blood pressure, then maybe your child is screaming and yelling and you're checking your blood pressure, so your blood pressure is up. So it's not necessarily accurate then. So that's why we want to see what somebody's blood pressure is like at home in a regular environment where they are hopefully calmer there. The other thing too is that we recommend, if you have diabetes or if you've been told that your glucose levels need to be checked, to actually get a blood glucose meter and to start recording what your sugars are like. And this is something that your doctor can tell you if that's something that's worthwhile for you to do, because maybe you are pre-diabetic and it's time to start monitoring these things. In order to help your heart, we've talked about managing your weight. This is where that BMI number comes in, and making sure that you have regular physical activity and exercise. Usually, folks mention about exercising 3 times a week, maybe for 20 to 30 minutes at a time. And I don't know. I don't know about you, but a lot of people hate the word exercise. And in my mind, what I think about is just doing something that you like doing that might get your heart rate up, and that might make you sweat a little bit. Maybe it's something as simple as going for a walk. If you like swimming, go swimming. If there's something else that you like doing that kind of gets that heart rate up, do something that you enjoy, because then you're more likely to keep doing it. Diet is extremely important. And there is what we have on the lower left on the screen, the diabetes plate method. And what this says is that make sure that about half your plate is full of non-starchy vegetables, that about a quarter of your plate, um, you have your carbohydrates, and the other quarter is filled with protein containing foods. Now, I know that they put a picture of a fish there, but it doesn't necessarily mean that you have to choose fish. There's lots of different types of proteins that are out there. And of course, drinking a lot of water. Now, there's a lot of drinks that are out there, and there's a lot of sugary drinks. And, there's folks that love to drink either their Coke, their Diet Coke, Pepsi, whatever you have. But that has a ton of sugar. If you look at the label and you see how much sugar is in there, there's a lot of it that's there. And instead of drinking that, water is so much better. And they have drinks now that have no sugar, but still have good flavor. And a lot of folks that end up developing diabetes, this is the biggest source of sugar in their diet. The reason that I'm harping on this is because having that extra sugar then tells your body, or it stimulates your body to make more insulin. And that starts you into this endless circle of making more insulin, because you have more and more sugar in your body. Then the body gets used to that insulin. And as you take in more sugar, then it tries to make even more insulin until your cells in your body get used to all that insulin, and then it doesn't have as much of an effect. And so when you do develop diabetes, a lot of times the doctors will first start off in type 2 diabetes with medications. And those medications are pills that will tell your body, hey, try to get used to, instead of being used to this insulin, start responding to this insulin instead. And those are the first type of pills that a lot of times doctors will prescribe. Sometimes they'll prescribe pills that make the body produce even more insulin. And sometimes, if these pills don't work, then instead they will actually prescribe insulin itself. And so this is how people will end up taking more insulin to try to get better control of their sugar levels. Now, absolutely, we don't want anyone to smoke, right? Because we know beyond uh, diabetes, we know smoking directly affects the heart. It directly affects your blood vessels. We know that it increases your chances of lung cancer as well. So if you are smoking, that's something to absolutely avoid. Today's the first day to try to start quitting. There's many different ways to try to do that. We know that diabetes directly affects the heart. And as a result, a lot of folks who have diabetes and are at risk for heart disease end up being told to go ahead and take an aspirin daily. And that's something that your doctor can recommend if that's something that you should be doing. And lastly, knowing what your cholesterol numbers are, because this is something that can directly increase your chances of having a heart attack as well. So these are different ways to make sure that your heart stays healthy. And we know that your heart is at increased risk when you do have diabetes. So all the more reason to adopt a heart healthy lifestyle.
We'll go to the next slide, please, and ask if you have any questions. And there are no questions that would laugh at or think like, oh my goodness. No, now is the time to ask a question. Dr. Parikh, you're doing excellent. Thank you so much.
Sure. And I think some of the questions may come towards the end once we start to see how significant diabetes is. And especially when it comes to the eyes. So, I talked about big blood vessels and small blood vessels. The eyes are an example of small blood vessels. And so diabetes directly affects those blood vessels. As there is sugar going around in your body, and there's extra sugar in those small blood vessels, it makes the blood vessel walls weaker. And as a result, those blood vessels can actually leak, and they can leak into your eyes as well. So if you start to see blurry vision after you've been told that you have diabetes, or dark spots or flashes of light, or even floaters, like a increased number of floaters, and those are those little shapes that you might see floating around as you're looking out into the distance. And even if at night your vision is becoming poor, these are signs that diabetes may be affecting your eyes. Now, when you have diabetes, we tell everybody that you must have an annual eye exam. And the reason for this is that eye doctor is looking for signs of diabetes affecting the eyes, and they can do things to prevent your eyes from getting worse. Even beyond just the diabetes itself, the high blood pressure, high cholesterol, even people that smoke, it can increase the risk of your eyes getting worse. So all the more reason to make sure that those things are taken care of as well. So when we look at folks that have diabetes, and especially those people that lose vision and they lose their sight, diabetes is the major reason for that for people that are between ages 18 and 64. So, going to the eye doctor is not a scary thing. And even little things that they can find, such as dry eyes, and that's something that they can test for as well. It may be simply taken care of just by putting like some wetting drops in your eyes. So over 800,000 Black Americans have diabetic retinopathy, and that's just a fancy way of saying that the diabetes is affecting their eyes. And 3 million Hispanics are at risk of losing their sight due to diabetes. So if that diagnosis of diabetes is made, seeing an eye doctor is an absolute must.
We'll get some questions now. Here's one. Why don't you have statistics for people who are white with diabetes? Now, the best response to that is Center for Change has access to all of the statistics. And if you'd like further information regarding specific races, ethnicities, we can lead you to that. All right. I am plant-based. What suggestions do you have for a well-balanced diet, Dr. Parikh?
So, I mean, truth be told, I'm plant-based as well, and I avoid meat. And I think it's a struggle, especially to get enough protein. The hard part with a plant-based diet is that a number of the vegetables, a number of the non-animal based foods are starchy, and there's a lot of things that have sugar in them. And so I think at least one thing that I started doing is really paying attention to what foods that I'm eating have sugar. And it's really easy to replace foods with things that are sugary. One of the things that I found, and this is just me personally, is really avoiding like potatoes, for example. I love potatoes. I think they taste great. Love my French fries and tater tots, but at the same time, they're very starchy. And these are things that can raise your blood sugar very easily. So trying to find substitutes for these things can go a long way. I think a plant-based diet is great. I don't think that everybody can do it, and but I do think that it's a great thing to employ, and again, I do this as well. But there's definitely a lot of resources that are out there to try to help modify that diet, at least to make it even healthier, to make sure that those choices that you're making don't contain a lot of sugar in them.
Mhm. Here's another question. This person has had to change their medication several times. What other medications other than metformin or glimepiride, and I might not be saying that right, um, are there? What about a different insulin? I'm currently on Tresiba, and this person has their 3-month follow-up with their endocrinologist next week.
No, so I mean, this is a great question. And in the last 10 years, especially, diabetes and the care for diabetes has exploded. There's all different types of drugs that are out there. So, metformin that you mentioned is one of those drugs that tries to uh, improve that sensitivity of the cells to insulin. And even though you are on some other drugs as well, there's no problem in combining drugs. And so, what your endocrinologist does, and for everybody else, this is a specialist that looks specifically at caring for folks with diabetes and other conditions as well. But what they do is that sometimes they will combine different drugs when they try to attack reasons for why the sugars may be high. There's a whole number of different types of drugs now that exist that even change how full you feel to try to decrease the amount of food that you're taking in. There are now new drugs that help your body, your kidneys, to get rid of the extra sugar in your body as well. These are new drugs that are out there, and folks are looking at them because a lot of the studies have now shown that some of these newer drugs actually will are better able to control your sugar. And even though you are on one type of insulin, there's a lot of different types of insulins that are out there. But what I would do is, or what I would ask is, go to your endocrinologist and say, hey, maybe I'm taking all these pills, I'm taking insulin. Is there something else that I could be doing beyond these medications to try to get my diabetes under better control? And there are things that are out there, right? Because even though there are medications, there is insulin. You saw even on that first slide that there's some lifestyle things that can be done as well. I had a patient a while back that was on insulin and medications and got rid of all of it altogether. At the end of the day, as his physician, I was a little afraid to keep taking him off of all these medications. And I felt bad because he got all of his medications down to one, which is his cholesterol medication. And I felt a little bit wary of taking him off, but eventually I did. But the way that he did it is that he found out that he liked hiking. And so he would go on walks every day. And with that, he lost a tremendous amount of weight. He was
Mhm.
on 3 different blood pressure medications, including insulin, and including 2 medications for diabetes. And all of that went away, all from losing weight. And with that, he was changing his diet as well. So that activity level was a big factor in getting rid of his diabetes. I'm not saying that's for everybody, and I'm not saying that everybody will have the same results, but I would say ask that endocrinologist, what other ways can you try to attack this diabetes? I think it's a good
Mhm.
question, but that definitely takes working with your endocrinologist on a close basis to figure that out.
And make sure, since we only see our endos about every 90 days or so, that you are keeping track of not only what your sugar level is every morning and perhaps every evening, or if you check in the afternoon as well, but how are you feeling? When are you feeling your best? Couple of questions for you, Dr. Parikh. Why is the health data higher for Hispanics? Is it their diet or lack of exercise?
That's a good question. I think the easiest answer is probably to say both, and maybe there are some things that we don't understand as well. I think, diet is a big factor, right? And sometimes it even takes changing your diet or modifying it just a little bit. Now, I'm of South Asian descent, And I even think in some of the foods that we traditionally eat, there are modifications that could be made to prevent folks from getting diabetes as well. I think the same thing could probably be looked at for all of our foods that we typically eat on a regular basis. It's just that, unfortunately, we eat that way because it tastes good. And that's the reason we keep eating it. So if we can change our taste buds a little bit, make certain substitutions that make food still taste good, but also be a little bit healthier, I think that that would go a long way. I think also exercise is extremely important, as you mentioned, and sometimes even culturally, it's not built into what we're doing. But it's not necessarily a cultural thing, right? I think it's exercise and staying active is something that doesn't necessarily doesn't necessarily apply to one culture or another. I think that's something that we can all do, and just we have to find something that we enjoy.
That we like. I love lots of fruits, Waverly says, and I make lots of smoothies, but I'm told they're high in sugar. Can you tell me what some fruits are that are a little bit lower in sugar?
So, and that's an important point, right? That our fruits have a lot of sugar in them, and so the biggest thing is taking things in moderation. There's something that's called the glycemic index, and this is something that I think is important for everybody to take a look at and to look up. So, what this is a number that is assigned to different foods, and what this number means is how likely is it to increase your sugar pretty rapidly. And what you'll notice on this chart is that different foods have different glycemic indices. So for example, I'm going to say that a donut, right? And nothing against the donuts, but they have a lot of sugar in them. And when you eat a donut, it makes your sugar go up really high. And then as a response, your body makes a lot of insulin to bring down your sugar. So that donut will have a high glycemic index, as opposed to something like brown rice. Brown rice, even though it's a carbohydrate, because it has that husk on it, it has that extra fiber that's there. And so it doesn't raise your sugar as much. The same thing applies to fruits. So with fruits, you'll notice that our fruits come with a lot of fiber built into it. Now, there's a lot of folks that like to juice, right? And what they do is they take these fruits and they put it through a machine and they get rid of all the fiber that's there and they drink the juice. Fine, there's certain nutrients that are contained within that juice, but you're also getting rid of the fiber. And that fiber is important in our bodies. Not only does it make us have bowel movements and stay regular, but it also helps to make sure that we don't absorb a ton of sugar at one time. So when nature made all these fruits and vegetables, it's man that created the juicing machine. And has these juices that have a lot of sugar in them. So the one thing I usually recommend is that if you're eating a lot of fruits, make sure that you have the fruit as a whole or that you have that fiber with it. Take a look at that glycemic index chart and you can see what fruits can increase your sugar more than others.
All righty. Thank you so much for all of your questions. Ann Salter said, thank you so much, Dr. Parikh. Moving on, keep your footing. Foot care is so important.
So this is huge. So remember I talked about big blood vessels, small blood vessels. This is something that affects small blood vessels. So, there's small blood vessels in your eyes, and as blood goes from your heart all the way to the tips of your fingers and even your toes, especially in your feet, diabetes will reduce the amount of blood going to that area. So what happens then as a result is that your nerves that are in these areas don't get enough blood. And as a result, some people get tingling and they don't feel things in their feet. I've had a patient that came in and something was stuck in their foot and they had no idea because of diabetes. Diabetes will prevent you from feeling everything in your feet. So, and what ends up happening is that when you go to the doctor's office and you have diabetes, they look at your feet. And even, don't rely on your doctor to look at them. You look at them on a regular basis as well. Make sure that you wash your feet and look at them to see if they've been injured, because when you have diabetes, you might not feel everything. So make sure that you're wearing shoes and socks and protect your feet as well. When you go to the doctor's office, usually they will take either a small pin to see if your feeling is intact, or they might take a little brush and also touch your feet as well to see if you can feel everything that's there. So you want to take really good care of your feet. Even seeing a podiatrist as well is something that's usually recommended when you have diabetes. So well recommended that even Medicare, if I remember correctly, will actually pay to see a podiatrist. So what this means is that the podiatrist will look at your toenails, make sure that they are trimmed, and this is something that you can do as well. Um, and just remember that the blood flow to your feet is not that great when you have diabetes. And so trying to wiggle your toes, try to uh, keep the blood going. But remember that diabetes can affect it. So take extra good care of your feet.
And one final comment on that, because of COVID, more and more doctors are seeing us via telehealth. So it's not a bad idea for you to take that brush, as he was talking about, and do your own feet and make sure that you can feel the toes, that you can feel the feet, the padding of your feet as well. Going on to the next slide.
And Ms. Monica, what I should mention too is that if this gets worse and if that circulation gets worse, the reason that this is extremely important is that as diabetes affects the toes, sometimes parts of the toes can become dark. And we have had a number of patients, because of poor circulation to that area, lose their toes and they have to be cut off. Otherwise, they can get infected. And sometimes even parts of people's feet will need to be amputated as well, because as that circulation goes down, those areas become what we call necrotic. What that means is that the cells in the feet don't get enough blood and they die. And so they become blue and eventually black. And sometimes even parts of the skin can just fall off as a result. So in order to protect the body, especially from infection, there will be surgeons that will cut off those areas. And this is all because of uncontrolled diabetes.
Mhm. Dr. Parikh, what about stress? How can that increase your blood sugar?
So stress is an important thing. And, we all talk about stress, right? Like we all have these stressful lives. And we know that stress can increase what's called your cortisol levels. This is a hormone that your body makes. Cortisol will increase your sugar levels as well. There's a, pathway that it does all this. But at the end of the day, stress is something that's under our control, right? This is how we deal with things. And even though our environment, there are things outside of us may cause us stress, but it's how we react to it that is going to determine what happens in our bodies. And so stress can be a factor in this. From stress, people can get all sorts of disorders in our body. But at the same time, I feel like this is something that's in our mind and how we respond to things that are outside of our bodies. So something that I would add to the things that you can modify when it comes to risk factors.
Okay, so I think we've gotten everything in there. Okay, one last question. One last question about our feet. What type of exercise can you do for the feet to help with circulation?
That's a good question. So that slide mentioned wiggling toes and moving your feet around. For the hands, it's a little bit easier because we can take stress balls and we can squeeze our hands to get circulation to our fingers, right? But for our feet, it's a little bit harder. It's not like your feet can squeeze something. But I would say that making sure that your feet stay limber, that your ankles stay limber, rotating them around, squeezing your toes and opening them back and forth are ways that you can do that. There's even little foot rollers as well that you can kind of roll around or have your foot roll on to try to stretch them out and relax them. I think this is something that is important to do. And try, to experiment and try picking up a pencil with your toes. This might be something that, can be fun to do. But at the same time, it does exercise your toes and tries to get them, moving and tries to get blood circulating to them.
Right. So no kidneying around. Kidney disease produces no symptoms until almost all functions are gone. Wow.
So this is the big organ that is near and dear to my heart. But when I talked about big blood vessels and small blood vessels, this is a mix of both. If I had to choose one, I would probably talk Probably more about actually both the big and small blood vessels. So what the kidneys are, this is our organ that takes all the blood supply in our body, cleans the blood and makes urine, and that's usually what we urinate out, right? And so the kidneys are the main organ for doing this. What happens is that in diabetes, when you have a lot of extra sugar floating around in your blood, the kidneys that are used to filtering the blood and cleaning things out say, oh gosh, there's too much sugar floating around. Let's get rid of this extra sugar that's there. So then what it will do is it'll take that sugar and put it into the urine. And remember, that's how we got the term diabetes mellitus, because now your urine becomes sweet if you were to taste it, but I don't recommend doing that. So your urine is now sweet, has a lot of extra sugar in it. And when you start to lose sugar in your urine, your body gets rid of more and more fluid. So as it does that, you become dehydrated, you become volume depleted, and other things start happening in your body. The kidneys don't like filtering sugar, and that starts to damage the kidneys. It causes a lot of inflammation and direct damage to all the things that, all the filtering mechanisms of the kidneys. So when this quote is there where it says kidney disease produces no symptoms until almost all function is gone, what this means is that as the kidneys are not working as well because of all this sugar, there's a lab test that is called creatinine. And this is something that the kidneys normally should be getting rid of that starts to build up in the body. When other things that the kidneys should be getting rid of start to build up in the body, that can change your appetite. It can upset your stomach. It can cause you not to sleep well and cause you to become weak. There was one patient that I had no idea that he had kidney disease. He was still walking up 10 flights of stairs. And then one day, just felt ill and came into the hospital and got his blood work done and was told that he needed to be on dialysis. Complete shock because he was so active. So anytime that anybody is diagnosed with diabetes, we start to look at the kidney function and we look to see if there is sugar being lost in the urine. And we also look to see if there's protein being lost in the urine. These are two things that diabetes can directly cause to the kidneys. It can cause that damage and make you lose sugar and proteins in your urine. So what happens in the office and in the endocrinologist's office, even in your primary care office, is that the A1C, which is this number that tells us how much of our red blood cells have sugar attached to it, and how much of those red blood cells have that sugar attached. And the higher the number that is, it tells us that over the last 3 months, how high on average our sugar levels have been. Now, remember, I mentioned that sugar is circulating through the body because those levels are so high, and that extra sugar starts attaching to things, and your red blood cells is one of those. So we can get an idea as to how well your sugars have been controlled over a 3-month time frame just by looking at this number. So you'll see this blood test being checked on a regular basis when you go to the doctor's office.
Okay.
In order to protect the kidneys, we need to make sure our blood pressure is controlled, that our cholesterol is controlled. We want to make sure that we are not taxing the kidneys and the heart. And so we say that to eat foods that don't have a lot of salt. And as we said, for everything else, staying physically active and taking your medications as you have been told to is extremely important. In the doctor's office, they will check your blood, they will check your urine to see if there is protein or sugar in your urine. And that will give everybody a sign as to whether or not those kidneys are being damaged by that sugar.
Any questions? Okay, so we'll pick it up a bit. We have 4 more slides to get to, and then we're done. I do have one question down here. Okay, actually, that was just a comment. Race and ethnicity on kidney disease. We're going to talk, I guess I'm going to let Kia do that one on the waiting list.
We can certainly talk about it, Monica. Thank you
Yes, let's
so
do it.
much. Yes.
So Kia Blair, as I said earlier, is with Our Legacy. And there's a whole lot that we need to talk about when we talk about giving. Today is Giving Tuesday. Wow, wouldn't it be something if we decided today to give one of our organs when we are about to perish so that someone else could live? That's what we're going to talk about with our legacy. But if you would like to focus on these numbers, or I can do it.
Or Miss Monica, maybe I should say one thing before Kia starts is that when the kidneys start not working, that's when we start talking about needing dialysis. Dialysis is a machine that replaces the function of the kidneys, and the large majority of people that end up needing this machine, they need it because of either diabetes or high blood pressure that has damaged the kidneys. Now, when folks are on dialysis, the only way to get off of dialysis is by getting a kidney transplant from someone else. And that's what I think Ms. Kia Malone will talk to us about, is ways that we can look at getting a transplant so that the folks that have gone or have started on dialysis can get off of dialysis.
Mhm. And I think I'll run through these numbers really quickly, Kia, before we begin. So if you look, you have more than 5,000 people are on the waiting list for all organs. However, 4,432 are on the waiting list for a kidney alone here in Florida. All right. Blacks are more than 3 times as likely to have kidney failure compared to our white families. And Hispanics are 1.3 times more likely to have kidney failure compared to whites. And again, it is based on diet, it is based on exercise, it could be based on some of the things that we talked about in our very first slide, and that would be who we come from, just who we come from. So now we'll move over to Our Legacy with Kia Malone. And Kia Malone is the outreach person for Our Legacy. So,
Monica, thank you so much for having me tonight. And I'm so excited to be joining you. I work as a hospital liaison, working with our hospital partners as well as our clinical staff to facilitate this wonderful life-saving mission of organ and tissue donation. And just to give you a background about Our Legacy, we are a federally designated nonprofit organ procurement organization. We are 1 in 4 in the state of Florida. The government established these nonprofit organizations to have a service area. In our particular service area, we are in East Central Florida. We have 10 counties that we service, incorporating 58 hospitals. And within those 58 hospitals, we have 2 transplant centers at Halifax Health Medical Center up in Daytona. That's a kidney transplant center. We also have a transplant center at Advent Health Orlando, where we serve our community. We provide support whenever there is a referral and we are looking at a potential donor hero. And let me just say this, and I'm going to say this many, many times, because I really, really, truly want people to understand. Our legacy and organ donation does not come into play. It is not a factor at all until the very end of a person's life. So if you are a registered donor and you were in a car accident and something happens to you, you can rest assured that that hospital staff is going to do every single thing in their power to save your life first and foremost. Only at the very end of your life do we ever come into play. So you'll hear me mention that a few times. We also, when our families, and we work with our families for decades, we've had families who have said yes to donation and have joined our mission many, many years ago, and they still work with us. But while a family is navigating this path of organ donation and they are in the hospital and they are saying goodbye to their loved ones, we provide that grief and emotional support to families, and we provide memory making as well as something to have for those families to have as a memento. And then one thing that I'm passionate about is just community education. In the few years that I've worked with Our Legacy, I've been able to experience the donation process from so many different angles, from being in the hospital while we are following a potential donor hero, to going into the OR, to seeing the process, to even sitting down with our clinical staff as they look for recipients. That experience has evolved into a passion where I really and truly want our community to understand this process, because organ donation and people waiting on the list, there are more minorities waiting on the list. 60% of those waiting are from multicultural communities. And it is imperative that we understand this process and understand that dialysis may not be the only answer, and that you can find help and relief through living and deceased donation. And even though our legacy only works with deceased donors, you do also have that opportunity and that option for living donation. And that information you can find with UNOS, and they talk about some of the things that the process of living donation. You can have a directed donation where you may know someone, a relative, your child, your husband, who needs a kidney. You say, listen, I might be a match, let me see. You also could be a living donor to someone where you say, okay, I'm not a match for my loved one. Maybe I can be a match for someone else. And in turn, they may know someone who could be a match for my loved one. That's called paired donation, when you have that type of living donation. And then, of course, there's also the non-directed donation, where you have so many people who are giving of themselves and say, listen, I want to help others. I want to donate my kidney. And you can only donate your kidney and part of your liver, by the way, through living donation. But there's so many people who say, I want to help others and provide that service to them. So even though we work with deceased donors, I did at least want to provide that information on living donation. And if we can go to the next slide. Our legacy, like I mentioned, we are one of the 4 nonprofit organ procurement organizations within the state of Florida. And we work with the United Network of Organ Sharing to find those recipients. Hospitals can't call other hospitals whenever they have a potential donor. They go through us. We facilitate this process. But wanted to share this information with you regarding how donation and transplantation affects our multicultural communities. More than 105,000 people woke up today hoping that they get that life-saving phone call from the hospital that, yes, we have your life-saving organ. But 60% of them are from African-American, Hispanic, Asian Pacific Islander, as well as American Indian communities. 60% of the people waiting for an organ are from those multicultural communities. And half of those people are African Americans. So this really and truly affects our community more so than from anyone else. The good news is that one organ donor can provide life-saving organs up to 8 people, restore sight to 2 people, and provide that healing tissue to more than 75 people. So we do have the opportunity to help so many people who are closest to us in our community. And it doesn't matter if you're Black or white, transplants can be successful regardless of the ethnicity. But when you have that more perfect match through a shared genetic background, it just makes that organ a longer term survival rate may increase. So it is so important that we discuss, what we may want at the end of our lives. We all, may go down to the DMV and register to be an organ donor, but we always ask, just go home to your families. And it doesn't have to be a long, drawn out conversation, but just say, hey, listen, if something were to happen to me, I would hope that you would say yes to organ donation, because I do want to help my community. I do want to help other people if nothing can be done to save my life. Monica, if we could go to the next slide. Something so important to talk about are the myths and misconceptions that we hear. And most people get their information about organ donation from what they see on TV. A 2019 Gallup poll said that 60% of those who had an idea about organ donation got that information from Grey's Anatomy or got that information from The Good Doctor. Even though I do think Grey's Anatomy is doing a better job this season, it's important that we have the facts and not rely on what we see on TV. So I want to make sure that we answer some of these frequently asked questions. And the main one is, okay, if I'm a registered donor Is that going to change my patient care? And again, I just have to reiterate, it will not. Your life comes first. And Dr. Bree can, attest to this as well. Doctors do every single thing they possibly can to save your life first, but only at the end of your life, only at, their irreversible loss of brain function, or only when your family decides to withdraw life support, then do we even come into play. Donation isn't even an option until those points in your life. Another question is, well, wait a minute, I can't have an open casket funeral. Donation does not affect your funeral plans. I probably guarantee all of us have been to one open casket funeral in our lifetime where that person could have been an organ donor and you never had an idea, you never had a clue. We take great care with making sure that that surgical procedure, because that's what it is. It is a surgical procedure that, we are very respectful and take great care of our donor heroes and making sure that the body can be presentable for for an open casket funeral. All religions also support organ, eye, and tissue donation. Talk with your imam, talk with your pastor, your bishop, whoever it may be, to talk about organ donation and your beliefs. Do you have to have some sort of financial status or social status in order to receive an organ? I have sat with our clinical team as they are looking at the United Network of Organ Sharing list of recipients, and they go through and they look at number one. After we've uploaded all the information from our donor hero, they look to see, okay, these are all the potential recipients who could receive this kidney or who could receive this heart or these lungs. And we start with number one, and we call that transplant center and we say, hey, we are at Advent Health Orlando. We have a donor hero. We're looking to go into the OR at this time. We see your patient is, listed number one. Would you like this organ? And they have an hour to respond to us and say yes or no. And if they say yes, we say, okay, stand by. We will coordinate everything and make sure that you can arrive on time. If they say no, we go to number two. We call that transplant center. Hey, we're here at this hospital. It looks like your patient would be a match for this organ. Would you want this organ? They have an hour to say yes or no. If they say no, we go to number three and so forth. Elon Musk is not on the list with $1 million hanging out to get the best organ. It does not work that way. We are bound by law to make sure we follow this list and we follow that numerical order whenever we are looking for our recipients. And then the most important is why register to be a donor. I can't say it enough. One person can save 8 lives. And when you are looking at 105,000 people waiting for that life-saving organ, and unfortunately, about 20 people will die today because they did not get that phone call. There's so much work to be done and so many people that we can help only at the very end of your life. One hero can also provide sight to 2 different people. And then one person can provide healing tissue up to 75 more. Monica, Charlotte Simmons, one of our dear friends, she's a kidney recipient. She received her kidney 20 years ago, and she was just a young high school student. Yes. And she found out, wow, you're in kidney failure. You desperately need a life-saving kidney. And Charlotte's got that kidney from a young donor hero who had just registered at the DMV to be an organ donor, but she went home and said, Mom, Dad, I want to be an organ donor. And if something were to ever happen to me, I would hope that you would support my wishes and say yes to donation. And don't you know, just a few weeks after that young child registered at the DMV, she was in a tragic car accident and she was able to save Charlotte's life. Charlotte has now gone on to be a recording artist, get married, have a wonderful, successful life, and an advocate and an ambassador for organ donation. And so, when you look at all the people's lives who can be saved, only again, after everything has been done to save your life, and there is no hope, no chance, your family has decided to withdraw life support, or you are determined to be brain dead, that is the only time organ donation is even an option. It's so amazing that we are able to help other people have a wonderful life, and we're able to help so many people in our multicultural community. So if you do decide to register, you can also register online. DonateLifeFlorida.org is the place to go, and you can be very specific. You can say, hey, I only want to donate my heart, don't take anything else, or you can say, take everything, and you can register there. But it's such an amazing thing to be able to help so many people right here in our community, and help so many of our multicultural people. So just grateful for being able to share this information with you. And Monica, thank you so much. And thank you for the Center for Change for having us.
Oh, listen, Ms. Malone, do you screen diabetics for organ donations? Can they still be donors?
So I would have to leave that up to Dr. Parikh to talk about the living donation aspect of it, and see if they can be organ donation. But diabetes is never a factor when it comes to being an organ donor. HIV is not a factor as well. An HIV positive donor hero can donate to an HIV positive recipient through the HOPE Act. And we've had a couple of those wonderful cases here in Orlando where we've been able to save the life of someone with HIV through organ donation, but only from an HIV positive donor hero. But no, diabetes is not a factor at all.
Great information, great information. Let's go to the next slide and see if we have any other questions out there that may be floating. So when we talk about what's in my control, Dr. Parikh, we go back to you. This is just wrapping up everything. What's in my control?
So, even in that first slide, we broke up those risk factors between things that are under my control and things that are not. And, our cholesterol is something that we can change our diet for and take medications for, making sure that we go and see the eye doctor as well, making sure that we have regular foot exams, and even making sure that our blood pressure is under control. Just really making sure that we are taking care of ourselves. That is the biggest thing that is under our control. And I remember, somebody asked a question about stress. I would add that to this slide as well. Stress is something that is under our control. It's under our control how we deal with things that are going on around us. So all the more reason to really take control of our lives, take control of all the management of things that are listed on here. And as that last point says, having regular doctor appointments and lab work when they tell you that you need them. That's the biggest thing.
That is it. So any last minute questions, anything that we have not answered, because as we are mindful of time, we're running, we started just a bit behind, but I think we've answered every question. And I think we've gotten all of our information out here. Now, the resources that we provide you with are the American Diabetes Association, the Centers for Disease Control and Prevention, Dedicated Senior Medical Center, and Von Zella Randolph's number is up there. And of course, our legacy with Kia Blair Malone. So Kia, thank you so much. Dr. Parikh, thank you so much. Is there a way to reach you, Dr. Parikh, if we had any further questions? Is there a general information number?
That's a great question. I think that some contact information I can provide to the Center for Change, and
okay.
You can also make that available as well.
And our legacy as well.
And I do have that number. It is 407-543-4100.
Okay. All right. I want to launch that post survey right now. And while we're doing that post survey, I want you to remember that on Wednesdays, we have Angela Allen over at the Rosemont Neighborhood Center. It's a great class. Join me, get fit for group exercise and yoga. If you're concerned about your pregnancy, we have a chance for you to work with a health coach, one-on-one health coaching through telehealth. We'll check your diet, your eligibility, et cetera. And there is a maternal telehealth program that is active right now, and you can find that information. It will resume on Wednesday. in January of 2023. So thank you all. Do not leave here. We had a robust evening. You know, I like to use that word, you guys, a very robust evening. Lots of information, lots of good responses. Dr. Parikh and Kia Blair Malone just sharing so much information with us. Now, the only thing we need you to do is get that diabetes post-survey questionnaire done, and we promise not to take it down too fast. So go ahead and do that for us. Our Legacies number is 407-543-4100, 407-543-4100. And I think it's always good, Dr. Parikh and Kia, when you can get all the questions out. And we got every single question answered, and that was so good. And family who joined us this evening, we thank you so much. This is our second year of doing this. And like I said, the pandemic caused us to go virtual, and we kind of like being virtual with you. It gives you a chance to ask your things anonymously. You don't have to sit there, and you can have your dinner while you're getting the information, except when we started talking about tasting a certain part of our bodily fluid. Did it become kind of Dr. Parikh? But it's true. It's true. All right. So we just wanted to say thank you so much.